Hey Cam followers, very, very welcome back. I am uber excited today because I am so excited to present to you the amazing Dr. Duncan Lascelles, who is back again for the third time. And I must admit, quite a few of the pain specialists keep saying, how do you do this, Hannah? He's so busy. No one can pin this man down. So we are really honored to have him back. What I would like to do is just quickly tell you guys about our children's book, because Cam is completely self-funded. So we have a few things in our shop. We do courses, we do education material. It is all there to keep Cam going, and this is our pride and joy at the moment. This is an illustrated children's book trying to encourage them to understand pain, recognize pain, and act accordingly around it. So that is available in our shop. If you'd like to know more, I'll be putting stuff in the thread, but let's not waste any time because I haven't got this man for long. I have him for about 55 minutes, I believe. So Duncan, please tell everybody a bit about yourself, and then everybody will have huge faith and trust in what you say.
Well, I don't know about that, Hannah, but I'll certainly say a few words about myself. But just a couple of points, things I need to pick up on. I'm not sure amazing and Duncan Lascelles should go in the same sentence. And yeah, I mean, I'm busy, like, you know, everyone's busy, but just to be clear for everyone who's tuned in, Hannah is persistent, like persistent. And I'm sure you know certain breeds of dog that are doggedly persistent. Hannah is one of those. Whichever breed you have in mind, she's one of those. She's very persistent, but it's an absolute pleasure to be here and to chat to you. So what was I supposed to do next? Oh, yes. Say a little bit about myself. So I work at North Carolina State University. I am a professor there. So I'm in academia. I'm a surgeon. I spend the vast majority of my time engaged in pain research, and that's split kind of 50-50 between clinical pain research, so using owned pet animals to better understand how to measure pain and to better understand what works to alleviate pain. And then I have a basic, we call it a basic research program. I'm not sure why it's called basic, because it's actually quite complex, but it's called a basic research program. So that involves benchtop work, looking at tissues, analyzing tissues, trying to understand what systems are driving pain in the species that we treat. So that's me.
Which is amazing to have those two aspects, because when you look at a lot of literature, it tends to be one or the other. So to have fingers in both pies, in very layman's terms, it means you can take stuff from the laboratory and put it into practicality. And that's what's really important, because I've only just really got into reading like clinical papers, and you're like, that's really fascinating, but it's so not relevant to what I'm doing in practice. And it's cool to be able to have you that can bridge that gap. So what we're going to do today, because we've done a couple of talks before, and I really would encourage you to go back and listen to them. They are brilliant. We've decided that we're going to try and take it from the owner question base. So the sort of things that you guys are asking, and we're going to let them drift. So I'm going to pose the first question, and we're going to see how it goes. So first question from Holly's Army. Does a pet have different types of pain like we humans do? Do they have nagging pain, pulsing pain, throbbing pain, piercing pain? If yes, what type of painkillers is most suited for these different kinds of pain? I think that's a big question.
That is a big question, but it's a really good question. And I think the answer to that, the first part of that question is yes. I'm convinced that dogs, cats have the different types of pain, as in, you know, dull aching pain, throbbing, stabbing, all of those descriptors that we might use. They experience those different types of pain. The difficult part for us, as owners, as veterinarians, as veterinary staff professionals, is identifying when those different types of pain are present. Because if you think about it, what you just heard described, things like stabbing, throbbing, sharp, those are descriptors of pain. And you know, we can say to a dog or a cat, you know, how does your pain feel? But we're not going to get an answer. Because they can't, you know, they can't describe that in our language. So that's a difficult part. So on the one hand, yes, I'm certain they do experience these different types of pain. I think there are some behavioral manifestations which might lead us to think that a particular type of pain is present. But what we need to do is we need to develop ways to measure that, ways to know whether or not a particular pain feeling is present. And why is that important? That's important because the neurobiology, the signaling systems, the cellular and molecular systems that produce these different types of pain probably should be treated differently. Okay, that got a little bit complex. So let me just sort of go back and reframe that. I'm sure everyone's heard of arthritis pain. It's generally, if you ask someone about their arthritis pain, it's dull, it's throbbing, it's background, it hurts when you walk. You've also probably heard about neuropathic pain, where people describe it as burning, stabbing, even the slightest touch appears to be painful. So those are two different descriptions of pain. And we know from humans that those should be treated, or more effectively treated, if they're treated with different medications. So that's what we're aiming at. We're aiming at trying to understand, to measure the different flavors of pain, the different types of pain that dogs and cats suffer. And that's what a lot of my research is aimed at doing, is trying to develop ways to measure these different subtypes of pain.
Yeah. And I can remember one of my colleagues saying to me once, wouldn't it be amazing if we had a blood test for pain? And it would be able to, there you go, quantified, done, dusted. We could even monitor that parameter dropping as we got control of the pain, which we can do with other conditions. For example, diabetes, we can watch our sugar levels, etc. Pain is much more complex than that. So just if you could expand on helping people with recognizing these different kinds of pain, because not meaning to pick on Sarah Jones at all, she's just asked what medication works best to relieve short-term pain. We can't answer that because we don't know what kind of pain. So what kind of presentation in a dog would you get with the arthritis pain? What would they do? How would they behave? And then let's move on to neuropathic and help people distinguish.
Sure, yeah. So I think the easiest place to start with arthritis pain is talking about the behavioral manifestations that are obvious. So dogs, for example, that can't jump into the car anymore, that have great difficulty climbing stairs, dogs that you see have great difficulty just getting up first thing in the morning. Those are obvious signs that we know are associated with arthritis pain. But arthritis is actually a young dog disease, and I believe that pain starts very early in life when the behavioral manifestations of that pain are much more subtle. You might see an altered way of moving. So these dogs are still performing. They're still going up and down stairs. They're still getting into the car, but they'll do it in a different way because they are adapting. They're adapting their movements to try and minimize the pain that they are feeling. You have to remember, dogs have been bred to please us. A dog gets up in the morning and all it wants to do is to please us. Okay, so when we ask a dog to do something, when we ask our beloved pet to do something, they are going to do everything they can to do it. And so in a sense, you might describe that as hiding pain. I don't think it's hiding pain so much as they adapt how they do things to minimize the pain they're feeling. That pain is present in the background. And so more subtle signs of pain would be a butt wiggle, okay? Swinging that butt, the backside from one side to another. I think often that's just thought of as cute and appealing. But actually that can be a sign of hip pain. And that butt wiggle is, and we can break it down in terms of the mechanics, that butt wiggle is performed by that dog in order to minimize the pain associated with hip osteoarthritis. You'll see a rounded back sometimes, subtly rounded back in these younger dogs. And that's, again, throwing their weight forward to minimize the pain associated with hind limb joint arthritis. So a wide spectrum of behavioral signs associated with arthritis. Now, when we get to neuropathic pain, its hallmark is that it's sudden, intense, often short-lasting, but it keeps coming back. And that type of pain is manifested by different behavioral signs. Dogs will yelp. Now, remember, I didn't talk about yelping with arthritis. Dogs really don't yelp with arthritis. But that sharp stabbing pain, they'll yelp. They'll maybe turn and look at an area. Odd tingling sensations associated with pain, with neuropathic pain. They'll start licking at an area, paying it a lot of attention. When I hear that a dog is occasionally lifting its leg up, just not using it at all, I don't think of arthritis. I'm more likely to think of neuropathic pain and some other acute pain conditions. So we can start to tease out the different types of pain through looking at behaviors.
Perfect. So that really gives people the understanding that when they go to the vet's processing a lot of information from the history, from the observations, from their palpation, from your accuracy of your history, and trying to bring together to make the right medication choice, because it isn't just one size fits all. But I'm going to kind of simplify it too much, considering I'm talking to you. But what about when there's that kind of crossover, when we start having upregulated osteoarthritis pain and it drifts over? Because I know that a lot of owners get confused with how there is the cohort of chronic pain drugs that kind of sit in between the two. And it can get very confusing. So can you just explain to them about like neurogenic pain? So there's a little bit of a gray zone in the middle, isn't there? So they'll see the overlap of drugs.
Sure. Yeah, let me talk about that. Just very briefly, though, you mentioned a very important word, or you said a very important word, observation. So as veterinarians, we should rely a lot on observation. And I encourage owners to bring in video of their pet in the home environment. Because remember, when you bring your pet to the clinic, it's an odd environment. It's unusual. There's other dogs, cats, and so on. We're not seeing what we would call normal behaviors. So grab video of your pet in the home environment and share that with your veterinarian. All right, let's get on to talking about how arthritis pain can actually move towards almost like a neuropathic or neurogenic type pain state. So the thing about pain is the longer it's present, the more the pain sensing system alters. It upregulates. And I think, probably that happens so that the organism is forced to pay more and more attention to the source of pain. Now, in chronic diseases, it's not that useful because the chronic disease is not going away. We know it's painful, but that pain will ramp up. And we, in this field, we use terms like central sensitization or algoplasticity. Those terms simply mean that the pain sensing system is being upregulated. What that means in clinical terms is that the pain experience alters and the degree of pain is enhanced or heightened. It also means that when we try and treat that particular pain state, so a long-standing osteoarthritis pain state, we often need to use multiple treatments because the changes are so complex that in order to interact with those changes effectively, we need to come at this from multiple different directions. We need to be hitting multiple different mechanisms at the same time.
Yeah, and I think that's a really bringing that into real world context as well. There's a lot of people that just think they're going to up the dose. So if their dog's not responding, so maybe they haven't observed the early signs. The dog's brilliant at tolerating pain and they've adapted massively, and they go and see the vet and the vet says, actually really significant discomfort here. We're going to start with this medication, but they might miss the start. They might say, here's the medication. And then that owner goes away and isn't seeing what they want to happen. And they're just thinking, oh, I'm going to ramp up the dose. I'll give it more frequently. And we really need to kind of step away from that, because that could cause the side effects that people associate with using that drug. Nonsteroidals, in my mind, get such bad press that they don't deserve. They're incredible drugs. The suffering that they save animals from, and then they get labeled with adverse events. So guys, take home is, when you go to the vet, do not be scared if they suggest more than one medication. That's not a bad thing. That means that your vet is going, right, I'm going to process it together, puzzle, safe cocktail, good. So don't be scared of polypharmacy at all. Right, let's move on. Do dogs feel pain constantly, or are there periods when they feel more pain? If yes, what external factors influence the degree of pain a dog feels? Do you know what? These questions are from Holly's Army, which is a community group. They're just amazing.
These are absolutely fantastic. Yes. So great question. Absolutely. I think dogs feel different degrees of pain from moment to moment, day to day, week to week. And there are a number of reasons for that. One explanation could be just the background disease, so let's think about arthritis, osteoarthritis. It's well known that pain from that varies from day to day, from week to week. I mean, I will go weeks with no pain in my feet, and then I'll go several weeks with horrible arthritis pain in my feet. And I don't know what I'm doing differently. I don't see that I'm doing anything differently, but that pain is just varying. So I think, the varying disease will drive pain, increase it, decrease it. But there are also other influences. And I think this is something which we're really starting to tackle, really starting to try and understand. Things such as anxiety, happiness, quality of sleep. All of these factors actually influence how much pain is being felt. Remember, pain is an experience. So it's up here, up here, in the frontal cortices. It's the integration of a whole bunch of different inputs to what we feel, what we experience as pain. And so you've got the signals coming in from, say, a painful joint or another painful area. You've got those signals coming in, but those are modulated. They're either enhanced or decreased by all these other influences. For example, anxiety, stress could decrease pain in an acute sense, but chronic stress, chronic anxiety will actually result in an increased pain. Sleep deprivation increases pain. If you're happy and distracted, that will decrease pain. So a lot of other influences. And so if you just sort of think about this, a dog in their everyday environment is receiving all these cues and influences. And so all of those can have an effect on the ultimate pain experience. And I think, in terms of, I am a clinician and I want to treat pain more effectively, understanding how those external influences modulate the pain experience and harnessing that understanding to better treat pain. I think that's part of the future we need to be moving towards.
I agree. And I think I'm just going to take the opportunity to go back to the young dog situation. So I was talking to a number of behaviorists only a couple of days ago, and we were all wishing that we could identify the disease a lot earlier in a lot younger dogs. But when you talk about how varied the variables are that influence the pain experience, and how the resultant picture in that dog's behavior can change so much in a day. So it's therefore really difficult for people to pick up consistent signs, to give them the confidence to go to the vet and say, I think there's a problem. And I actually took some material from a human chronic pain website where a person was describing their pain. And they were saying, every day is different. I can wake up in a different state every time. I'll talk to my doctor and they can't see it. They can't understand. It's a very lonely thing in humans, because you're trying to express, yeah, okay, I'm okay today, but I was really bad yesterday. So please take me seriously still. And the final sentence, which I've found really powerful, pain changes everything. and it changes the way that they eat, the way they move, the way that they clean themselves, the way that they go to bed. This person's pain state affected so many different areas of their life. And I think we just need to kind of be able to identify these potential signs, bring it together for the clinician to be able to receive said information and have the confidence together to go, okay, there's a possibility this is pain, let's go look for it. And I think that really isn't very easy in the current consult system, is it? Because vets are very limited with time. It's not the right environment to really talk about it because it's so stressful. So guys, go back to what Duncan said, take as much information as you can. And if you see something that's fluctuating, it doesn't mean it's not there. Have the confidence to write it down, take that information to the vet with you. Right, next one. Do dogs have different thresholds for pain? E.g., do some dogs yelp and limp while other dogs with the same trauma would stay silent?
This is, okay, fabulous question. So, and something I'm actively looking into. So here's what we know, that veterinarians believe sensitivity varies across breeds. And veterinarians absolutely agree on this, okay? Across all veterinarians, we as veterinarians agree. Owners absolutely believe that sensitivity varies across breeds, but they don't agree with veterinarians. But owners absolutely agree within themselves, okay? So now we have two different groups of people that believe sensitivity varies across breeds, but those two groups don't agree with each other. Here's the interesting part. We've just completed a large study, myself and Dr. Margaret Gruen at NC State. Actually, she led the study, so I'm just kind of like, tagging along here. Breeds do vary in their sensitivity, but not in the way that veterinarians believed and not in the way that owners believed.
Ooh.
So stay tuned. Breeds vary in sensitivity, and we'll hopefully be able to paint a more detailed picture of that. I think the other thing, though, is that you have to remember there are also breed differences in how they manifest behavior. And that, that is an overlay there. So some breeds are more demonstrative, other breeds are less demonstrative. That doesn't mean that the pain is less in the less demonstrative breeds. It's just how demonstrative that breed is. And then you've got the individual dog variations in behavior as well to overlay on top of that. So somewhat complex, but I think if you just look at the question, do different breeds vary in their sensitivity? They do, but not in the way we think.
No. And I'm going to add another variable, is us allowing them to express pain, which will bring me on to my next question. Because I've got a really a strong opinion about this, and I think you actually agree with me because you said it earlier. Do dogs hide or mask pain, and how can you tell? I went a little bit ranty in a webinar recently, just saying, actually, I really don't buy into this hiding thing.
No.
And I just feel that we need to look at all the situations that we put them in. Are we allowing them to express pain, like a rat in a cage, a dog on a tight lead in a small back garden with no time with their owner because the owner's too busy? And are we actually observant enough? So I put hiding pain right down there.
Yeah, I really don't think that dogs hide their pain. And as I mentioned earlier, I think what they do is they try and please us, and they will adapt how they do things in order to still continue to please us. So they don't hide their pain. I think there's another thing I just want to bring up, and maybe this is a good time to do it, because we've been talking about young dogs, and I think so. A young dog is adapting in order to continue to please us, even though they're suffering pain. But also, we've got to recognize that we may not want to recognize or diagnose pain in a young dog. I think there's a lot of reasons for that. It could easily become a rather depressing conversation. The idea that this young dog that you have is suffering pain. I mean, kind of, it's almost, on one level, it's better to sort of close your ears, close your eyes, and ignore it. because it's worrying, because it's potentially depressing. But I think we need to turn that conversation around. We need to be looking for early signs of pain. We need to be recognizing those early signs of pain, and we need to be treating, because that improves the future for those pets. What we don't want is for a pet to go 6, 7, 8, 9, 10 years in pain and then only pay attention when it's an emergency, when the dog can't get up, when it can't go out for a walk, when it can't climb stairs. That's the wrong time to be paying attention. Pay attention earlier, get these dogs on a better course earlier, and improve their future.
Yeah, definitely. I tell you what, we need to do that puppy socialization model, because there's so many puppy socialization classes in and around the world. Every evening of the week, they're bringing 6 to 8 puppies to socialize in that very first period. People at that point are like, I want the best food, I want the best bed, I want the best harness, I want the best everything. And they're so receptive. And at that point, we can go, right, let's tell you how animals express pain, absorb this information. So we need to do that. That's what we need to do. So yes, we were talking about hiding pain. I'm just going to do a little tangent. I've also got a problem with the word cope now, because I did create a little lecture piece recently, and I thought cope's still got some positivity into it. Oh, he's coping really well. And I'm like, coping is almost like it's sustainable and it's acceptable and it's long term. Yeah, he's okay in a coping state. I'm wondering whether tolerate, or we just have to think about our terminology and how it comes
I
across.
like that. I like that.
Oh,
yeah.
Thanks. I'm going to take that and I'm going to roll with
Yeah.
it, and I'm going to throw you another question.
Yeah, no, but that's absolutely right, because I think cope is somewhat positive. You know, you can kind of ignore it, and what we've got to recognize is that these dogs are doing everything they can to minimize pain, but there's still pain in the background, and we only really recognize it when it's a major problem.
Yeah, exactly. And it is that phrase where you go, oh, he's not coping at the moment. That's really kind of like a negative. So we should be careful with the use of. I love this second part to this question. Being lame but still happy. How can a dog be lame but still happy?
Well, I mean, I think very, very easily, because it goes back to, you know, dogs have been bred to please us. We have bred dogs so that their whole demeanor is to please us. And so, yeah, absolutely, a dog can have pretty bad pain in a limb, almost to the point of not using it, but still be trying to please us, still looking happy, still moving around on 3 legs. So absolutely, that happens.
Yeah. And I think also when you can localize something. So somebody once said to me that what's the kind of worst kind of pain? And they were like hinting at back pain and neck pain kind of cripples you. It really takes over you and it kind of spreads, and movements, any movement affects that kind of area of your. But when it's maybe just your wrist, you can kind of localize it and keep it at bay. So I wonder as well, is there an element that they're not suffering so much, so it's not affecting them behaviorally because it's localizable and it's weight bearing, for example. It's not when they're sleeping, it doesn't, but we can talk about that. Next question. My vet has prescribed pain relief, but I am not sure it's making a difference. This is common. How can we help them?
So that is a really good question, and it is difficult to know. What a lot of us are trying to do are to develop tools to help to help pet owners with that. And so you'll find for a number of conditions there are questionnaires which you can ask your vet about, ask Hannah about. She knows all these questionnaires. So send an email to Hannah, and she'll direct you. Your vet can direct you towards these questionnaires, and these are validated measures of the impact of different types of pain. So that can be very helpful. Also, work with your veterinarian. You know, if a medication is being prescribed, you don't think it's making a difference, talk to your veterinarian, because dogs are individuals just like us. You know, I get pain relief from ibuprofen. I get nothing from celecoxib, nothing. And dogs are the same. So there are these very individual reactions to medications in terms of whether or not you see a benefit. I think one thing, maybe just backing up is before that medication starts, capture some video. I know I keep going on about video, but it's so useful. Take some video of your pet moving around in the home environment and put that away. Start the medication and then capture some more video after 2, 3, 4 weeks of your dog doing the same things in the home environment, and look at that video. And that, because I think it's very easy for shifts to occur that don't necessarily register with us. But when you look at 2 sets of video, you might say, oh, yeah, there really is no difference. Or, wow, hang on, look, he's moving much more easily, or she's moving much more easily. So video is a very helpful tool. But also remember that, some medications, just that particular type of medication may not be beneficial in your pet, or that particular type of nonsteroidal may not be beneficial. You may need to switch to a different nonsteroidal. So there are a number of different factors playing in here.
Yeah, definitely. And I'm loving the fact that the Canbastas are out in force because they're well trained. Also, be patient is another thing. We did a practice training on Sunday and really pushing the message out there that a 7-day course of an anti-inflammatory for a dog that's had pain for 8-9 years is hopeful. We've got to give these medications a chance to work. And another thing somebody said, how long to trial medications? It depends on the medication, but it could be 4 to 12 weeks. There's a big indecision there, isn't there? There's people giving different advice from anything from 4 weeks up to 12 weeks is what I'm hearing. But the other thing is also, and we've seen this a lot, is owners' expectations of what they should see mask what they do see. So you'll have an owner that will be like, no, I haven't seen any improvement, because they expect him to start hopping over the sofa again and then jumping in the car. But actually the dog hasn't got that ability, but their mood is better and they're engaged. Right. And I see that a lot, and it's not the vet's fault. They just haven't got the time to tell you this. But maybe when you go and see your vet, say, right, we're starting a new medication. What do you think I should be seeing? Give me my expectations, because otherwise I might be disappointed. So, oh, cool. That's that. 2. I'm 2 up now.
Right. Hey, hang on just one moment, Hannah. Yes. I don't know what the weather's like in the UK, but I'm getting sunburnt here, so I'm just going to close the curtains. Hang on.
I love the fact that everybody's saying pain questionnaires. This is well trained, guys. I'm impressed. And what's great about CAM is that all the stuff that you guys know and you're spreading, what impact we are having. So high five everybody that's put down using a questionnaire. I think that's perfect. I'm going to do one more question from this amazing list, and then we're going to cut back through a few of the questions that people have posed, because I don't want you to think I'm ignoring you, because I know that Duncan has to go in 28 minutes. So next one, which is where we were. When can I expect nonsteroidals to help? When should I ask for something else if I don't think it's working very well? Let's just finish that, because we've kind of covered that. What's your thoughts on the nonsteroidal? How long do you use it for? And how do you talk to an owner about potentially swapping onto another? And how many of you will you try before you leave that family of medication alone?
Okay, great. So to answer that question directly, you probably want to give nonsteroidals about 7 to 14 days, thereabouts. I think if you don't see a benefit within that period of time, then that particular drug may not be able to provide benefit in your pet. And what I do clinically is I will then switch to a different nonsteroidal. And, we can talk about how you make the decision from one drug to another, but I will switch to a different nonsteroidal. If that second nonsteroidal doesn't provide benefit, then I will ask myself, okay, maybe nonsteroidals are not going to provide benefit in this particular pet, and I'll then move on to some other options. And I think one thing I'm going to do moving forward after today is, as a result of Hannah's comment, I'm going to talk about expectations. Because when when owners come back in 10 to 14 days and I'm talking to them, I'm essentially asking, have you seen any positive difference? And I should probably set expectations right at the start. I should let people know, hey, these are the types of improvement you may see. You may see your pet running around more, using that limb more, or you may just see them, they're happier, more comfortable, sleeping better, those sorts of things. So, and all of those are positive. All of those are positive and not to be dismissed.
No, I love it. And that's great, because I've learned something from you massively there, because I look at what lots of other people are doing, and so a lot of people are doing 4 to 6 weeks. So you feel after 2 weeks you've got a pretty good understanding whether they're going to respond. That's brilliant.
Yeah. Now, if there's some response, but it's not sufficient or it's not what we want, then I'll start to add in other medications, other treatments, and so on. But I think for nonsteroidals, if you've not seen a response in 7 to 14 days, rethink the strategy, move on to a different type of nonsteroidal. Yeah.
But are you, I know I was listening to Kenneth Jabot, and he was saying that there are the non-steroidal studies that show improvement over time. So would you still kind of expect them to see a marginal improvement within 7 to 14 days? And if you see that, you go, stick with it. We're going to keep seeing improvements over time.
So, we've certainly, we did those studies showing that nonsteroidals show a progressive benefit over time, and they do. But I think what you're looking for initially is some improvement. If there's no improvement, that's where I would say, okay, let's switch to another nonsteroidal. And if there's no improvement there, let's switch to something else. I do expect to see some improvement initially. And then I would expect to see further improvement gradually over time.
Cool. And I'm just going to add a little anecdotal story. It's actually very tough for a first opinion vet to be making these decisions. Believe it or not, there's been times where you take a dog, you put him on a medication, it's cost the owner some money, they've not seen improvement, they come back to see you, and you say, I want to do a washout and do another one. And they're like, oh, do you now? Cool, great. I've still got to pay for this, yeah? And then if you even think about doing maybe a third, wow, those facial expressions are hard to manage. So guys, go into the vets with an open mind. They're not just playing roulette. There is method to their madness. And I had one where I swapped from one nonsteroidal onto another, and the dog just got really sleepy, and they're really upset that we went that direction. But the intention was good. I was like, I had method to my madness, but it hasn't worked out for your dog. So let's go back and let's try something else. So be kind to your vet. Right, so let's go into some of the questions here, because we haven't got very long. So here we go. What would you give, meds, nutraceuticals, or do physio, etc., to young dogs that you described that live with OA in a subtle way? It's quite a good one, because this is where people worry, because they've got the life of the dog ahead, and the idea of being on meds for life is terrifying.
Yes, Andy, thank you for that question. Great topic to bring up. So, and I think it really comes down to, once we get better at recognizing these adaptations and better at appreciating those adaptations can often be the result of significant pain. And this is where it gets confusing. The dog's still moving around, still doing stuff. And so we can easily say, oh, there's no pain or it's minimal. No, that's not necessarily true. The dogs are spending a lot of energy to adapt and cope with, not cope, we weren't going to use the word cope, tolerate that pain. Okay. So my approach here is better recognition, better understanding that that is significant pain, and then treat that pain effectively. And that means essentially at the moment a combination of drugs such as nonsteroidals, gradually increasing exercise. I'll add omega-3 fatty acids to the diet. So there's a supplement, but one that actually provides some benefit and will optimize weight. And if we were going to get into the details of my treatment regime, it's essentially a 3 + 3 month treatment regime. 3 months full on, and then over the next 3 months, I'm decreasing the drug with the aim of stopping it. And what you're doing is you're resetting the system, you're getting things under control, you're instigating some lifestyle changes, and then you can move on in a pain-free state without the need of drugs. And this is probably the biggest myth in arthritis. People say arthritis is a lifelong disease. It is. But pain management doesn't necessarily have to be lifelong. If you
Mm.
start early, if you correct the problem, you can then stop the medication. And so, I would encourage you to try not to think about OA pain in young dogs as needing supplements and save the, over here, they call it the Hail Mary, that sort of final pass in American football. Save the Hail Mary for when they're old. The Hail Mary being the nonsteroidals. No, use those effective analgesics early on. Get these dogs into a better state, normalize them, and you'll be able to stop those drugs.
Yeah, very powerful statement. I am going to cut this out and I'm going to put it everywhere, because people do believe that once they're on it, it's for life. And
yes,
there's the fear of the meds, there's the fear of the consistently going back to the vets, the blood test, the urine test that come with it, the finances. So please stop thinking like that, guys. This, I just want to definitely touch on this, because this is a really emotional thing and it's common. We see this a lot in Holly's army, and it'd be just interesting to see. So my girl was diagnosed with severe arthritis August last year. She's on a cocktail of drugs, Galliprant, gabapentin, amantadine, and Pardel. She is an anxious dog and reactive at the vets. We've seen no improvement. She's sadly getting slower. She's only nearly 8. It breaks our heart. What kind of things spring to your mind at this moment?
Yeah, so I think that is quite the cocktail. So you've got in there, you've got a non-COX inhibiting non-steroidal, you've got gabapentin, you've got amantadine, you've actually got Pardel as well, which is a different type of a non-steroidal, and so that's quite the cocktail. And I think for me as a veterinarian, and I don't know the case and I don't know the background, I don't know what the details, but as a veterinarian, I would say, okay, if there's been no improvement, we probably need to reevaluate what's going on. Just as an example, and I'm not commenting directly on what may or may not be going on with your pet, but there could be neurological disease, which is causing, slowing down or problems that may look like arthritis. There could be other things going on. So whenever, there's a cocktail like that and there's no response, the first thing to do is to reevaluate. And any veterinarian is going to subscribe to that. Just reevaluate, recheck everything. There are some dogs, unfortunately, who, where the arthritis pain is just not responsive. The good thing is we are expanding the toolbox. We, the vet profession, we are expanding the toolbox. And so there are some new tools recently being approved, anti-nerve growth factor monoclonal antibodies. So we have other choices to move to. We have other options, and hopefully the future will produce more alternative options for pets, just like it sounds with yours, and not your pet just not responding to those medications.
Yeah, and another angle that might be happening is the mistake I made, and I'll put my hands up. This is me learning. My dog had cervical disc disease, and I had her on gabapentin, and because I thought she was worsening, I pushed the gabapentin up. I thought she was worsening, I pushed the gabapentin up. Came off the gabapentin, she weren't that bad. So I misinterpreted her clinical signs, thinking it was caused by the disease, but it actually was caused by the medication. So potentially reviewing your medication might be another thing.
Thanks for bringing that up, Hannah, because that is important. More is not always better. All of these drugs have some sort of side effects, and if you as an individual have ever taken gabapentin, you'll know the side effects. Amantadine, all of these drugs, and so as Hannah's just said, that gabapentin can cause sedation, and that could be misinterpreted as, oh, my dog's not doing very well, and it might actually be better to back off that.
Definitely. I made it. I took her to North Downs referral service, and they were like, Hannah, come on. I was like, oh. Okay. What about this one? Why are so many dogs, young dogs, getting arthritis?
Well, okay, in a nutshell, and I'm not going to go into a lot of detail about this, but I think obviously genetics plays a role. Why does genetics play a role? Because most arthritis in dogs is driven by developmental disease, and so we just have to face it. If we want a dog to look a certain way, that comes with a certain set of genes. and some of those genes will increase the chances of developmental joint disease, and that drives arthritis. So genetics plays a role. Feeding plays a role. I think overfeeding young dogs, and we know that from good solid data, overfeeding young dogs too many calories over the lifetime, that drives arthritis. A lack of or inappropriate exercise, that can drive arthritis. And I'm just going to say this very quickly, and then we'll move on to the next question. Early spaying and neutering, that can drive joint problems. Let's move on.
Let's move on really quickly, because I'm going to take you out of the frying pan into the fire. Supplements.
Great. Yes, fantastic. Good. We are hitting up the hard questions today. So here's, and I'm going to be pretty blunt about this. So firstly, there are no supplements that have been shown to decrease the progression of osteoarthritis, to decrease the progression of disease, or to restore cartilage in the joint. None. Zip, nada, nothing. Okay. That's the holy grail of orthopedics, and no one has achieved it. So supplements do not alter disease progression. Some supplements can have a mild analgesic effect. And note I said mild. And so across a variety of different supplements, there is the potential for that. The one that stands out for me are omega-3 fatty acids. So these anti-inflammatory fatty acids, the omega-3s, adding those to the diet, using those supplements, I think can be a benefit and will add to the analgesic effects that you're getting from combined treatments.
Yeah, and I think we'll move on because there's many more Facebook Lives about that, guys. It's a topic that comes up again and again and again, and it is just one of the tools in the toolkit. But unfortunately, it kind of has a lot of stage presence, where it should actually just be amongst the stage show, not the whole stage show. Leading on to a more positive, what other pain management methods could be used? So throw them a few ideas of sort of things that you would incorporate into a plan.
So, I think obviously it's important to think about the drugs to get solid pain relief on board, but it's also important to think about the other aspects that we can leverage to effect pain management. And we're talking about arthritis, we're focused on arthritis. One of the most important things is movement, exercise, rehabilitation. And so for certain animals, rehabilitation or therapeutic exercise is important. That's what's needed. For most dogs with arthritis, they just need to move. And that's walking on a lead, or as they call it over here, a leash. Okay, just need to walk. And just to emphasize this, the pain relief that we as humans get from exercise is exactly the same as the degree of relief we would get from non-steroidal anti-inflammatories, exactly the same. So exercise is as good as drugs. But here's the thing, they go hand in hand. You often need pain relief to allow that exercise to happen and gradually build up over time. And then once we're exercising more, we can decrease the drugs. And so that's, pain management should be dynamic. Another thing, well, we talked about omega-3 fatty acids. I think that's an important consideration. Another thing that I like to talk to owners about is massage therapy. Again, any of you who've had joint pain will know that often with that comes muscle spasm and pain associated with that. And that can be as bad, if not worse, than the original joint pain. So I teach owners to do massage gently on their pets in the home environment. It helps release that tension and decrease the pain that compounds the problem. I think other things, and I'm getting a little bit kind of arty here, but change things up for your pet. Take them to a different dog park, change the walk route. Just, it's the same as with us, variation and distraction can really decrease the pain experience. So yeah, add some interest into your pet's life.
Yeah, and what you hopefully people will go to the CAM online shop. You'll see that that's where we're really trying to focus, is on, as you say, distraction, engagement, movement, education, because that's really lacking. People kind of get online and they go down to the pathway to find something they can give by mouth, and you're like, no, get the dog moving, get them distracted and engaged. So guys, that's really important. I want to take the last 10 minutes and just get you to give us a few little tasters of what the future might hold. We talked about it briefly. Is there anything that you can tell us is coming our way, on anything to do with pain management, before you run?
I think there are three areas where there are important developments which are going to enhance the future with respect to our ability to manage pain in pets. The first is measurement. As we've mentioned a couple of times, we need to be able to recognize and to measure. At the moment, that's based on our subjective visual assessment. And the near future, are going to see tools, whether it's wearables, whether it's artificial intelligence analyzing video, tools that will really help us as owners in the home environment to determine when pain may be present. So there are huge advances happening in measurement that are going to be useful. The next is our toolbox. As veterinarians, we would like more tools. We talked about how individual dogs react better to individual drugs and maybe not so well to other drugs. So we need more tools. We've already seen an expansion of that toolbox, as I mentioned, with the anti-nerve growth factor monoclonal antibodies. There are other tools in development based on a number of different platforms, both local treatments, which is a really important area for us to look at in the future, as well as systemic treatment. So more tools are coming down the line. And then I think the third area where we're going to see changes in the future is we are going to improve our understanding of the other factors that contribute to the pain experience. We're going to improve our understanding of anxiety, of the role of quality of sleep in pain, of fear. We talked about happiness. We're going to understand better what influences pain, which in turn is going to point us in the direction of how we can then leverage that understanding to better manage pain. The future's bright, by the way. It's really optimistic. There's a lot going on, and in another 10 years, we're going to be having very different conversation, much deeper understanding of pain conditions, subtypes of pain, and how to manage pain. And we're going to be talking more about the individual. At the moment, we talk about groups. We talk about dogs with arthritis. In 10 years, we'll be talking about different subtypes of arthritis, and we'll be talking about the individual. If your dog shows this, and this, it's most likely to respond to this type of treatment.
Wow, that's so cool. And that's just so positive and really exciting. And what we while you were talking about understanding of the external influences that can influence pain that isn't just medication related, one of my daydreams for the CAM shop is going to be that people come in and they get asked what their dog is doing, what their dog is showing them, so behavioral signs, physical changes, capability changes, and it creates them a kind of list of non-therapeutic interventions that would be good to have. The most appropriate bedding, the non-slip boots, the rugs, the stuff. So people can expand their mind and they don't get caught just in the pill trap, which pills are important, but there is a bit of a pill blinker, isn't there?
Well, I think partly that's because, if we look at the way we manage our own ailments, we tend to reach for medications, a quick fix. But it's more complicated, it's more nuanced, and it should be more complicated and nuanced than just pills. Medications to help get on. I mean, I love it. You talked about non-slip mats. I've mentioned massage therapy, exercise. All of these things we need to be thinking about and managing pain in a holistic way that is individualized for each patient.
Yeah. Well, on that note, have you got 5 minutes to just answer a couple more questions, or would it be kind for me to let you disappear? Because I am so precious of your time.
I actually have an important call meeting at 3 p.m. So I have
Exactly
2 minutes.
See, I'm kind.
One question.
There you
go.
go.
One question. Quick.
Okay, one question is, do they become tolerable to nonsteroidals? So will an animal become tolerant to their nonsteroidal, causing them to want to swap?
No, not tolerance as in tolerance to opioids, but I think the mechanisms that are driving pain can shift. And so if you see a decrease in efficacy to a nonsteroidal over time, you might want to change to a different nonsteroidal because they're actually all quite different drugs, and or add in another treatment to that. So it's not tolerance in terms of opioid tolerance, it's just shifting drivers to pain.
Love it. Thank you, Duncan.
You are very welcome.
It makes me so happy. So thank you so much, guys. Thank you so much for listening. You've had a record audience tonight. We had 120 people listening at one point. This will hit thousands within 24 hours. So well done, you.
Hannah, are the pubs closed or something tonight?
I've got COVID. I'm not allowed out.
Okay. All right. Bye, everyone.
See you later.
Take care. Bye.